Semaglutide, a potential game-changer for chronic kidney disease. The promise of semaglutide for CKD patients. Semaglutide, a medication with an intriguing mechanism of action, has shown remarkable cardiorenal benefits in adults with chronic kidney disease, CKD, regardless of their diabetes status. This finding is a ray of hope for those managing CKD, a condition that often comes with a host of complications. But here's where it gets controversial. While the results are promising, there's still a need for more extensive research to fully understand the long-term effects and general applicability of semaglutide. Understanding the meta-analysis. A recent meta-analysis, a powerful tool to aggregate and analyze data from multiple studies, has shed light on semaglutide's potential. The analysis included 5 randomized controlled trials, providing a robust dataset to work with. The results were clear. Semaglutide significantly reduced the risk of major cardiovascular events, kidney-related complications, and cardiovascular mortality. The study's lead investigator, Mahitesvay, and colleagues, emphasized the medication's dual benefit of improving cardiovascular health and kidney function. They also highlighted the potential for semaglutide to reduce the need for intensive pharmacological interventions, which could improve patient quality of life and adherence while lowering healthcare costs. Addressing the research gap. The research team conducted a systematic review of major databases to identify studies comparing semaglutide with a placebo or standard care in adults with CKD. The primary outcomes focused on major kidney-related adverse events and cardiovascular risks, while secondary outcomes included all-cause mortality, serious adverse events, and the use of cardiovascular medications. The analysis included data from over 12,000 participants with CKD and type 2 diabetes, T2DM. The patient population had a mean age of 64 to 67 years, with a predominantly male demographic and elevated body weight and BMI. Interestingly, one study, APOLLO, had a younger cohort with a mean age of 55 years and a unique non-diabetic CKD population. Key findings: cardiovascular and kidney benefits. The pooled data analysis revealed a significant reduction in cardiovascular mortality risk with semaglutide, along with a consistent 22% reduction in major cardiovascular adverse events, MACE. While there was a trend towards reduced non-fatal myocardial infarction and non-fatal stroke, these outcomes were not statistically significant. The kidney outcomes were equally promising, with a 20% decrease in major kidney adverse events among patients receiving semaglutide. The medication also showed a trend towards reduced all-cause mortality and was associated with fewer serious adverse events. Secondary outcomes and sensitivity analysis. Semaglutide showed a modest reduction in the need for cardiovascular medications, corresponding to a 14% relative risk reduction. There were no significant differences in hospitalizations for unstable angina or heart failure. Sensitivity analysis further supported the medication's effect on serious adverse events. Conclusion and future directions. The investigators concluded that semaglutide is a promising therapeutic strategy for CKD management, with or without diabetes. However, they emphasized the need for long-term studies to confirm its role in reducing hospitalization and mortality rates in broader patient populations. This research opens up new avenues for CKD management, but it also raises questions. What are your thoughts on the potential of semaglutide? Could it be a game-changer for CKD patients? Share your insights and let's spark a discussion.